Good afternoon, ma'am.
Okay, so for this afternoon, I have asked you to watch prior 3 lecturettes on HIV, emerging diseases, and substance abuse. Okay, especially in this situation wherein there is a pandemic such as the coronavirus, it's evident that the coronavirus is an emerging disease by definition. And what do you remember with the definition of emerging disease? How was it defined in our previous lecture? Or even through context, how do you define emerging disease? What is it?
It's a disease occurring for the first time.
It's a disease occurring for the first time of, well, as you have seen your coronavirus, of public health importance. Okay. Yes, it's important that we look at your emerging disease, but what is happening in our situation is such that because of emerging disease, of the presence of your coronavirus as an emerging disease, what happens? Then we tend, the diseases that we have already controlled are taking a backseat as far as prevention and public health is concerned, because there is an emerging disease that we have to take care of. And what is that? Your other diseases previously controlled are now re-emerging. And what are the examples of your re-emerging diseases? What are the examples that you could think of?
Measles, doctor.
Measles, okay, so others previously eradicated. Measles. How about the status of HIV, substance abuse? Taking into context of emerging diseases, these took a backseat and therefore although we could not say that it was controlled, it is re-emerging, or there is also a problem with its prevalence and incidence, especially more so in the background of your emerging disease coronavirus. Okay, so how is it? How is it in India? Okay. This is a national strategic plan for HIV, AIDS, and STI. So, and for your sexually transmitted illnesses. It was a 2000. I'm sorry. It was a 2017 to 2024 program with the aim of what? Paving way for an AIDS-free India. Okay. Remember, um, it is not an HIV-free India. So it's an AIDS-free India. So HIV is present. However, it aims to control your HIV as a virus such that it doesn't develop into your full-blown acquired immunodeficiency syndrome. And how bad is it a problem in India? Would you have an idea? I will send you the file of this national strategic plan so you could study it as an additional knowledge for you when you, especially when you go back to India as a study material. Okay. How is it? Epidemiology in India. So this was way back in 2014 to 15. This is what was used in your national strategic plan. HIV positive per population less than 0.5%, 0.5 to 0.99%, and brown would be more than or equal to 1% with some having no data. And those brown and reds shows that more or less you have at least 1% or at least a 0.5% population that is HIV positive. I know you will say it's just 1%, it's just 0.5%. But remember what? Your population is in the billion. So what is 1% of 1 billion? How much would that translate to as far as number of people afflicted with HIV is concerned? What is 1% of 1 billion?
A million, doctor, maybe.
It's a 10 million. 1% of 1 billion is 10 million.
Okay, so you could imagine 10 million in some countries. So even if you have that at 5 million for the 5%, it's still a significant number. People are, I'm admitting people. Okay. So what's the transmission in India? It's still sexual intercourse mediated. So you have your males, male to male sexual intercourse, eventually having intercourse with their spouses, and then maternal transmission, drug interaction, and eventually with their children. Okay, so those are number one is still sexual, Second would be your drug interaction, and third would be your maternal vertical transmission. Okay. So the aim of that strategic program is for an AIDS-free India, and its mission would be to attain universal coverage of HIV prevention, testing, and treatment to care continuum that is effective, inclusive, equitable, and adapted to population and local needs. So the goal of which is to achieve zero new infections, zero AIDS-related deaths, and zero AIDS-related stigma and discrimination. Okay? Okay. The vision, okay, so universal coverage of your HIV prevention, testing, and treatment. Okay? Sorry. So the framework is based on a relationship between that vision, mission, and goals. So these are articulated in terms of inputs, outputs, and costs in the implementation plan. Okay. So there are risks that may affect the results, but combining these strategies would calibrate according to the epidemiology, priorities, and resource scenarios of different provinces, as stated. Okay. So we have different objectives. Okay. So we have objectives and outcomes for this strategic plan. So objective would be to reduce new infections by 80% by 2024. Sorry. So outcome of which would be new infections are reduced from greater than to 100,000 to less than 21,000. Okay. Your second objective, link 95% of estimated people living with HIV to services by 2024. Outcome of which that those people living with HIV know their status. Okay. Third objective is to ensure antiretroviral therapy initiation and retention of 90% of people living with HIV for sustained viral suppression by 2024. So outcome of which 1.9 million of people with HIV are on our ART, are retained and have sustained viral suppression. Okay, objective number 4 is to eliminate mother-to-child transmission of HIV and syphilis by 2020. So attain its elimination by 2020 is the outcome. Fifth objective is to eliminate HIV-related stigma and discrimination by 2020. HIV/AIDS considered as a chronic manageable disease eventually. And integration, facilitate sustainable NAC per service delivery. So outcome would be integration of identified components of NAC, PNH, and NHPM. Domestic funding for NACP is 100%. Okay. To achieve these objectives and outcomes, we have different priorities. And the priorities would be the following. So accelerating HIV prevention in at-risk group and key population. Expanding quality assured HIV testing with universal access to comprehensive HIV care. Elimination of mother-to-child transmission of HIV and syphilis. Address the critical enablers in HIV programming, and restructuring the strategic information system to be efficient and patient-centric. Okay. And for emerging diseases, an update, of course, you have your SARS coronavirus as one of the severe pandemic of our era. And the other diseases that are likely to cause severe epidemics would be the following. So you have your Crimean Congo, Ebola, Marburg's, Lassa fever, MERS, SARS, Nipah fever, and Rift Valley fever. Okay, and this would be your map with regards to your emerging diseases according to country. So it would still depend. So you have your E. coli as a vector, West Nile, your Lyme disease, dengue virus still, E. coli, SARS, avian influenza in Asia, malaria, although the WHO did not include some diseases because public health programs are already in place. So this would include your HIV still, your tuberculosis, malaria, and dengue because we have public interventions in place. The others are listed because primarily they don't have a wide-scale national program or global program that will combat its existence. Okay, I think that's just a few slides that I would want to add. Okay, so substance abuse also, especially in this pandemic, okay, coping. It's a form of it becomes a form of coping for some people. You know that, well, substance abuse, you know that these certain drugs are bad and detrimental to your health. Tobacco is one. Even if you plaster all those side effects on that cigarette box, people still buy it. Okay, even if you put in increase the price, put in sin tax, you increase the price to 10 pesos per stick, people will still buy it. Okay, same way with alcohol. Kidding aside, they would say it's okay for you to put the Philippines in lockdown, just don't do liquor ban. And that's how they look at liquor, and they look at liquor or alcohol as a friend and as a coping mechanism. And for the extreme, you have your drugs abuse. So it could be your upper, it could be your downer, it could be your recreational drugs. But it does not, as you have seen in the video lecture, it does not choose socioeconomic status. Yes, there may be gender predilection for males, but it does not choose your socioeconomic status. Rich or poor may be enamored with the psyche or um, with what drugs could give you. And you as public health advocates eventually or defenders of your public health system, when you do become doctors, should know at the very least that substance abuse is a problem, your HIV is a problem, and there is always a chance for emerging disease to occur. Hence, the relevance of these 3 lectures. Okay, so I just wanted to supplement and reinforce the 3 lectures that I have asked you to view for this afternoon. Are there any questions? And it's a challenge. Okay, the international, I think I've mentioned this to your president. The international always has an HIV awareness day every December 1. Last year we weren't able to hold one, and it's a challenge for your batch and for the international students, that even if we cannot hold HIV awareness day physically, I challenge you that we do something for HIV awareness come December 1 for the year 2021. Okay? So it's a tradition of the internationals and it has been going on for some time. Okay, don't let this pandemic beat you. Okay, I want you to continue on with that tradition and that's a challenge for all of you. All right, any questions? I did not turn on my video. Any questions?
No, doctor.
There's none, you may leave this call. Thank you for attending this lecture. Okay, so you review the 3 lectures. If you haven't, okay, it's the part of your attendance is filling up the forms that I have sent you so that it's easier to cross-check if you viewed the video or not. All right? Okay, you may leave this call.
Thank you, doctor.